Hello, I'm Dr. Susan Pullman. I'm president of the Canadian HS Foundation. Our mandate is to help Canadian dermatologists look after patients who have hidradenitis suppurativa. A big part of that is educating our patients about HS. So today I'll be giving a broad overview of HS that will allow you to talk with your dermatologist about treatment options that might work for you. So first, what is HS? HS is a condition that is an inflammatory condition. It's not contagious. It is not infectious. It's inflammatory. It's a genetic condition that can be inherited from your mom or your dad, and essentially there's a genetic mutation in the lining of the hair follicle that's associated with the formation of painful boils or abscesses. These boils tend to be in the fold areas, under the arms, in the groin, or in the buttocks, but they can be really anywhere in the body. These boils in someone without HS usually go away with time. In someone with a mutation in the lining of the hair follicle that has HS, these lesions become full of pus and gunk and dirt and inflammatory cells, and they can rupture, causing tunneling underneath the skin. So they can actually be larger than they look. And this is what makes HS such a challenging condition to treat. HS is oftentimes misdiagnosed in patients. In fact, the average time patients sometimes will wait is 9 years to see a dermatologist. Patients go to their family doctor and they get maybe incised and drained lesions, and next time they have a flare they might go to emergency room. And oftentimes there's several years before a patient actually gets a diagnosis or a patient is referred. This is a problem. And so how do we treat HS? Well, I make the analogy that all the different factors that influence HS are kind of like spokes on a wheel. Lots of different things that influence it. There's a genetic component we already talked about, nothing you can do about that. But there are other things that influence HS like smoking. Smoking can make HS worse, so if you can quit smoking or even cut back the amount you smoke, that can be very helpful. Another factor is diet. We know that HS patients will do better with a low glycemic index diet, so avoiding sugar and carbohydrates can be helpful. Another thing is trying the keto diet. The role of cutting out dairy is somewhat controversial, but in general, avoiding skim milk, the whey or casein and protein powders can be helpful as well. Some people will simplify it, telling their patients to avoid white sugar, white flour, and white milk. Another spoke on the wheel is hormones, especially for women who have flares around the time of their period. We can talk about anti-androgen pills like spironolactone or aldactone, which is a blood pressure pill, or birth control pills like Diane-35 or Yasmin. These can be very helpful, especially in mild disease, to control the hormonal aspect. What about inflammation? I mentioned earlier that HS is an inflammatory disease, and anti-inflammatories are at the center of how we treat it. So your dermatologist will talk to you about antibiotics. Remember, the antibiotics are being given for their anti-inflammatory effect. We don't want you to think there's an infection there. If your dermatologist treats you with 3 months of antibiotics, you would qualify for the more potent anti-inflammatories, which can substantially improve the quality of your life by calming down the inflammation and reducing the number of flares, which can be quite painful. Right now, there's only one approved biologic therapy in Canada, and that's what we call adalimumab, which is also known as Humira, or it goes by several different other names, which are the biosimilars for adalimumab. Why would you need a biologic to treat HS? I kind of make the analogy it's like an avalanche of inflammation, and people who have a lot of inflammation, there's a large burden of disease. So you can ask yourself, would you go into an avalanche setting with sand toys? So topical therapies, sometimes other treatments are kind of like sand toys, and we really need a dump truck that will handle the amount of inflammation that's there. And so the adalimumab or the biologic medication that your dermatologist gives you is kind of like the dump truck. And if you have severe HS, that's what you would need. Your dermatologist will be able to tell you if you are at the stage of HS that would require a dump truck or a biologic medication. Another very important part of treating HS is surgery. Deroofing surgery is used when there's one lesion that keeps coming back to the same area. What we can do as dermatologists, or you can see a surgeon for this, we can freeze the area up with local anesthetic, and then we clean out the area surgically. It's called de-roofing. We let the area heal in secondarily, so we don't close the area up. And that allows the area to heal in beautifully with minimal scarring. Most importantly, patients get great pain relief from de-roofing surgery. Please ask your dermatologist about it if you have one lesion where the HS keeps coming back to, almost like a magnet in the same location. Ideally, prior to the de-roofing surgery, your dermatologist will likely prescribe antibiotics or the more potent biologic therapies, just to calm everything down so you have a better result with that de-roofing surgery. What are some other things that you can do for HS? Laser hair removal is very effective for HS, so if your dermatologist offers it at their center, you should ask about it. There are also some clothing lines that are very good because they wick the moisture away from the skin, like NYX clothing and HydroWear. And you can check out these products on the Canadian HS Foundation website. You'll find links to those sites there. There are also many great patient support groups that have links on our website, such as HS Heroes, which can be an excellent source of information with many podcasts there. Other things your dermatologist might recommend could include zinc supplements with copper or topical resorcinol cream for flares. For your HS flares, when you have a painful boil, you can ask your dermatologist if they have a policy that they could get you in urgently for an intralesional Kenalog injection. This can help your flare go down faster and get you out of pain sooner. The last thing I want to mention is there's a free ebook on the Canadian HS Foundation website that you can download at www.hsfoundation.ca that's written specifically for patients, with lots of frequently asked questions that are answered there and good evidence-based recommendations. Overall, it's a time to be hopeful for patients with HS. There are new treatments that are soon to be approved in terms of biologic therapies and clinical trials that are underway with several promising new molecules. So don't give up hope.